Hello, this is Dr. Grande. Today's question is, does primal therapy really work? Now, primal therapy is a relatively obscure therapy that was used to treat mood dysphoria and mood dysregulation. Sometimes it's referred to as primal scream therapy, but the actual name was primal therapy. The Primal Scream is the name of a book that was written about primal therapy and published in 1970. So primal therapy, as I mentioned, is obscure. It's not used much today, and there's a bit of controversy surrounding it. The central idea behind primal therapy is that neurosis, which is a term used generally to describe anxiety, depression, mood dysphoria, neurosis is caused by repressed trauma. So individuals have trauma particularly early in life, under the theory used in primal therapy. So they have these traumas early in life, and these get repressed. And then over time, that repression intensifies. The pain associated with that repression intensifies, and the neurosis becomes more marked and more disturbing. And the only way to unlock that repression, to integrate those repressed memories and feelings, is to have some sort of catharsis. Now, I'm simplifying this quite a bit. There's actually a lot of information about primal therapy out there, but that's the general idea behind it. So in primal therapy, somebody would try to go back to an infant state or a childhood state, and they would maybe throw a tantrum, scream and yell, cry, and hit inanimate objects like pillows. And the idea was that, again, these repressed memories become integrated and the person becomes whole and the neurosis goes away. So is this theory really valid? Does primal therapy really work? Well, there's no evidence that really supports that primal therapy works. No scientific evidence. Now, evidence, of course, comes in many forms, but my preference would be, in order to use a treatment, I would want to see some sort of scientific evidence, experiments that were conducted, and I'd like to look at the results of those experiments, and in those results, I can usually tell if it makes sense to use a treatment or not. It's really basing the practice of mental health therapy on science. As I mentioned, though, there are many types of evidence, and I think one of the reasons that primal therapy was so popular, particularly in the 70s, was that evidence other than scientific evidence was used. For example, testimonials are out there in terms of primal therapy. A lot of testimonials. People saying that it worked for them, even if there's no scientific evidence that supports that it works in general, that they had a good experience with it, and that it cured neuroses, it cured all these different symptoms when other therapies failed. Now, the problem with testimonials is, even though they are technically evidence, there is a bias inherent to them. So, first of all, positive testimonials seem to get published more than negative testimonials. And if you go in believing something's going to work, and most people do enter treatment believing it's going to work, you're going to have a bias toward seeing evidence that tends to support that conclusion. And I think that is likely what happened in the case of primal therapy. So we could think of testimonials as a starting point. When somebody develops a new mental health therapy, say they have 100 clients, and 98 of those clients come back to the therapist and say, I believe this really worked. That's a good sign. That's a good start, but that's not scientific. That may give somebody the idea to start conducting experiments and building research on that therapy, but testimonials in and of themselves don't really mean a lot. Another element we see here with primal therapy may be the placebo effect, the effect of a non-active ingredient. So it could be that the therapy does not work, but because of the placebo effect, a lot of people believed it did work. Another good explanation for what happened there was catharsis. So when somebody's crying and yelling and screaming and even hitting pillows, there's going to be endorphins released. So they're going to feel good, similar to how somebody who runs might feel good. That high, that runner's high, is temporary, and the benefits from catharsis are oftentimes thought of as temporary, particularly if it's not integrated with other changes like cognitive or behavioral changes. So there are a lot of reasons why a therapy like primal therapy could look effective, even though that it's reasonable to say it's not effective based on evidence. Another element with primal therapy is when it was popular in the 70s, there were a lot of celebrities involved with primal therapy, and that tends to allow a therapy to gain a lot of attention that may not really be warranted. And also, primal therapy and the theory behind primal therapy was really tied in with the politics of the day, the politics of the 1970s. So the theory had a lot to say about how it was related to the counterculture and to reason and rationality and to capitalism. So there were a lot of politics tied in with the theory. Now, whether a theory has political implications or a commentary on politics or not really doesn't matter in terms of its effectiveness or ineffectiveness, but it's just another area that might draw skepticism. So is primal therapy practiced today? Well, generally, most practitioners reject the idea of primal therapy. There are a few practitioners that use it in various settings, some in very controlled settings where they're careful about how they screen potential clients for that treatment. Others probably not as much, which is unfortunate. It's not mainstream by any measure, and as I mentioned earlier, it certainly, I think, would be considered obscure at this point. Another concern with primal therapy that we've seen lately is the idea of releasing aggression in controlled settings. And I know that this is a technique that's used in a variety of therapies, not just primal therapy. However, evidence in this area suggests that if somebody's trying to regulate their mood, particularly trying to reduce the risk of aggressive behavior, that engaging in aggressive behaviors does not seem to lead to that result. It doesn't seem to lead to a reduction in the risk of aggression. So even though the idea of punching a pillow, for example, may seem harmless, and it may even seem like a good idea in the context of primal therapy or in the context of other therapies, the evidence doesn't support that that works. I believe the history of primal therapy has a lot to teach us as mental health practitioners. When we develop mental health treatments, we need to be careful to conduct proper research and experimentation and critically analyze the results. We can develop and use mental health treatments that seem to be effective and become popular even though they may not actually be effective. So I think the history of primal therapy teaches us again that we need to use caution when developing and utilizing mental health treatments. I hope you found this description of primal therapy to be interesting. Thanks for watching.